In this video, we are going to be talking with Dr. Jenn Simmons. I met this incredible woman at the Holistic Leadership Council retreat last year when we were in Mexico, and I was sharing my work about fascia decompression, and she approached me afterward and asked if we could partner in creating a breast health program. So I am so incredibly honored to have you here, Dr. Jenn. But I just want to share your bio so everybody understands how incredible you actually are. So Dr. Jenn is a breast surgeon, integrative oncologist, author, podcast host, and founder of Perfection Imaging. Introducing Dr. Jenn Simmons, a pioneering force in the world of breast cancer care. Once a renowned breast cancer surgeon, Dr. Jenn transformed her practice after her own journey as a patient, becoming an integrative oncologist with a mission to revolutionize breast cancer diagnosis, treatment, and screening. Again, I am just so incredibly blessed to have met you and to have you here. And I would love it if you would share your experience as to what really brought this passion forward in your life.
Yeah, absolutely. Well, first, thank you for having me. I am so incredibly grateful to have met you. Really, when you spoke to us about your story, about what you do, it moved me and it resonated with me, and it compelled me to reach out to you because I know that there's tremendous synergy between us. So thank you for that. I actually didn't pick breast cancer. I think breast cancer picked me. I really don't remember a time in my life where I didn't know about breast cancer. It was absolutely part of the fabric of my family. And nearly every woman in my family got breast cancer, with the exception of my mother, who got colon cancer. So there wasn't a time in my life where I didn't know about breast cancer. And growing up, I had a hero. She was my first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music. I'm going to date myself now. She wrote all the music for the Spinners and the Stylistics. She wrote 54 hits in all. She was beautiful, brilliant, larger than life, the queen of Motown sound in Philadelphia. She would walk in a room and light the place up. So her most famous song that she ever wrote was The Greatest Love of All. So she wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali, but it really received its acclaim in March of 1986 when Whitney Houston would release that song to the world. And at that time, it would spend 14 weeks at the top of the charts. Only my cousin Linda would never know. Because at the age of 37, Linda died of metastatic breast cancer 1 month after Whitney released that song. I was 16 years old and my hero died. Her life and ultimately her death gave birth to my life's purpose, because I never wanted another woman, another family, another community to have to suffer the way that mine suffered. And as a 16-year-old, I did the only thing I knew how to do. I decided that I was going to become a doctor, the first doctor in my family. And then I became a surgeon. And then I became the first fellowship-trained breast surgeon in Philadelphia, the first oncoplastic surgeon in Pennsylvania. And I did that really well and for a really long time. And I did it long enough for my aunt to be diagnosed and long enough for my mother to be diagnosed. And I was about 15 or 16 years into my career. And I was arguably at the top of my career and one of the most sought after breast surgeons. And I was at the same time running the cancer program for my hospital, and a wife and a mother and a stepmother and an athlete and a philanthropist, and had all the energy to do what I needed to do, and went from being probably one of the most high functioning people you've ever met to I couldn't walk across the room because I didn't have the breath in my body. And I underwent a 3-day really extensive workup. And at the end of those 3 days, I found myself sitting in the office of my friend and colleague and physician. And he told me that I needed surgery and chemo and radiation. And despite the fact that these were things that I said all day, every day, without hesitation or reservation, I can tell you that when these words are coming at you, they have different meaning. And when they were coming at me, they did not land. I remember just floating somewhere above that room. And even though I knew what he was telling me was standard of care, and even though I knew that this is what I had recommended to thousands of women, including the day before that, there was a voice that I couldn't silence. And it was telling me that there was something more, and go find it. And I was a very conventionally trained physician. I was running an accredited cancer program. It's not that I had some glorious insight. I didn't. I had, you can call it God, you can call it universe, you can call it whatever you want to call it. I had a voice that I could not silence. And so I went on a journey, and it was a very selfish journey. This wasn't about changing the landscape of breast cancer. I thought I was, right? This wasn't about anyone but getting me back to work again, getting me back to life again. Probably the biggest thought in my head was that my kids were small, and God loved my husband, but they were not ready to be left with him. And so I went on a quest to go figure out how to heal. And I was very fortunate, though God is great. So I'm not sure that any of this was an accident. But I was very fortunate to very early on in this process get introduced to someone who ended up changing the course of my life. And anyone who reads my book, The Smart Woman's Guide to Breast Cancer, you get the full story. But the abridged podcast version is that I'm sitting in a room and this tall, lanky guy walks on stage, big toothy grin, and he introduces himself as a functional medicine physician. Now, even though I'm on a quest, I'm still very, very traditional, let's say, and not so open yet, and cynical. And so all I could think of is, I've been a doctor for 20 years at this point. There's no such thing as a functional medicine physician. What is this quack talking about? And then I remember that I'm sick and I'm there for a reason. So I check my ego at the door and I tune in, and thank God I did. Because this quack turns out to be Mark Hyman, who is arguably the figurehead of functional medicine. And what he was going to tell me over the next 2 hours was not only how I was going to heal myself, but actually how I was going to forever change the world of breast cancer, because I never, from that day forward, approached a patient again the same. And what really resonated with me, and what was most profound that I learned that day, is that in conventional medicine, we're focused on the wrong thing, because all of our focus is on the symptom. And in the case of cancer, all of our focus is on the tumor. But the tumor is not the problem. The tumor is never the problem. The tumor is the symptom of the problem. And unless you figure out why that tumor is there, why that cancer is there, you're never going to change the trajectory of anyone's life. And this was a concept that was completely foreign to me. We didn't talk about root cause medicine in medical school, and never was a doctor talking about the why. I mean, we were taught that the why, we gave this bullshit standard answer, right? It's multifactorial, and there's nothing you can do. We were literally trained to rob people of all of their power, of all of their sovereignty. We were literally trained to do that. And in doing that, we farmed out our care to someone who does not have our best interest at heart. And I am not saying that doctors aren't kind, wonderful people. They are. But their interest is being a good doctor. And what a good doctor means in this current system is that you're a good diagnostician, right? That you can make a diagnosis and prescribe. That's what a good doctor is in this system. And I don't want to be that anymore. I didn't want to be a part of the problem. I needed to be part of the solution. And so I'm an early adopter. I immediately enrolled in the Institute for Functional Medicine. I spent the next 3 years submerged in the study of functional medicine. And I came out on the other side knowing that there was no way that I could stay in the surgical system, in that conventional cancer care system. It was just something that I felt so strongly about that I had to change the way that we diagnose, change the way that we treat, change the way that we screen for breast cancer. And the only way that I was going to do that is if I got out of that system and started a new one. And that's what I did.
Holy smokes.
Yeah.
I'm a little speechless, I have to say. First of all, thank you so incredibly much for your authenticity, vulnerability to share all of this. And I think so many of our listeners will thank you for getting breast cancer because.
Yeah. So I want to be clear. I didn't have breast. I had thyroid.
Okay.
But yes. And you know, what I say to people is we're never grateful for our diagnoses, right? Like, that's not something to be grateful about. And it's not a blessing, but it is a blessed opportunity if you can frame it that way. And I don't want to make any pretense. I was not happy about my diagnosis. I was not happy at that period in my life. It was very, very difficult. And I cried way more than I didn't. And my recovery was not linear. And I got a lot worse before I got better. And I didn't immediately identify the help that I needed. And it took me a long time to figure out what I needed on my own. And so the path to healing is not easy. It's not linear, and it's not ever over. Right? So it goes on today, and health is not a destination, it's a journey. But for the person that can embrace the journey and see the journey itself as a blessing, that perspective takes you a long way, and you will almost certainly be rewarded with such amazing, meaningful events in your life as a result. And had I stayed as a surgeon, I would have continued on a very, very, very dangerous path. I don't even think I would be here now, quite frankly. I really wouldn't, because you're so narrow, you're so tunneled, and even my values have changed so much. And so my life is infinitely better than it was before, infinitely. And I am truly living the life of service now that I wanted to live then, but there's no path to it within that conventional model. And I think so many people find purpose within their diagnosis that changes them forever and in a really good way.
For me, that was certainly the truth. My discovery of how to approach the fascia in the way that I do was born from horrendous anxiety and internal pain, internal turmoil, and all of the efforts that I was applying before I understood this were taking me in the opposite direction to the goal. And I always look back at those moments and, well, not always. It took me probably, I would say, 7, 8 years to be able to look back at the person that I was before I uncovered this and actually see that little girl that I love, as opposed to being ashamed and all of the other words that I would use to beat up the person that was that version, because I literally hated her for so long and I was ashamed of her, and it was expressed in how I looked, how I communicated in my behaviors. And so when I went through the journey of uncovering the fascia and understanding adhesion and how to find the breath and how to find the path inward, I remember the moment when I was able to look back and say, wow, if it weren't for that messed up young woman, this wouldn't have happened. So I do very specifically remember that moment when the flip switched for me, and I was so happy that I was on this path amidst all the struggle and the suffering, because on the other side of it, we get to see the lives that we impact and learn from, and the communities that we build. And that's such a wonderful part of why we're here together, because we both have these communities, and to be able to bring them together and share our collective wisdom as well as others that will be involved is, I'm so excited, because I just feel that I feel so many people are just going to have this incredible moment of peace that they've been searching for. And I think for me, that's always the biggest thing, is I just want to feel at peace inside. Whatever life is throwing at us, which we can't control, if we can approach it from that place of peace, then we make very different decisions than if we're in fear. And that's what community, I believe, is really here for. And I just want to thank you so much for being such a strong, amazing voice and a warrior to bring to this world a different approach, a different perspective, and a different mindset around something that is absolutely terrifying for so many people.
It is. And it's unfortunate, but there are so many stories like ours where people have had tremendous pain to tremendous purpose. And I think a lot of it is because we default to safety, right? And we tolerate a lot because we inherently fear change. And that is very much built into us, in that uniformity meant safety historically, right? And you didn't want to step outside of the cave alone. You didn't want to step outside of the tribe alone, because that was very dangerous. So we all default to tolerating a lot, because we are programmed, we are inherently programmed to fear change. And what that translates to into so many people is they will tolerate a lot of symptomatology. They will tolerate a lot of pain. They will tolerate a lot of dysfunction, because change for them is so scary. And unfortunately, they'll tolerate it to the point that they get a diagnosis. And we listen to the whispers. We really only listen to the screams.
Yeah.
And so things have to be bad for us before we really commit to change. And even, like I'm sorry, Mom, I'm going to throw you under the bus a little bit. But when my mom was diagnosed with colon cancer, and she had been very overweight my entire adult life, which is a risk, actually my whole life, not just my adult life. My mom has been very overweight. And we know that that is a risk factor for both breast cancer and colon cancer. And yet that alone, and she's very vain. She's a beautiful, stunning woman, an ex-beauty queen. I look nothing like her, by the way.
You're a beautiful woman.
And yeah, she's beautiful way beyond anything, any attractiveness I have. And she, like, just the vanity wouldn't make her change. But when she got her cancer diagnosis, she changed everything. And I mean, this is a woman who watched me remake my life and, find any stage I could to scream about all of these things that I believe in so deeply, all the food, all the nutrients, all the nourishment, all the lifestyle. Like, she's heard me say it 1,000 times, and then she got her breast cancer, then she got her colon cancer diagnosis. So she makes all of these pretty profound changes, but it wears off after a little while. So, 6 months ago, I turned around to her and I was like, Mom, you're back to the same. What do you think is going to happen? Where do you think this story ends? So it is hard, and you can't white knuckle your way through it, right? Like, it just doesn't endure. And you have to make these changes part of the thread of your being, right? They really need to be the new you. Because we don't want to have to rely on terrible pain and suffering to force us to change. So I think if you can find new purpose in that new person, that's really the key. Because it's very hard to go back to the old you and expect a new shiny version. I'm often reminded of when Mark Hyman talks about that you are the summation of the 5 people that you're closest to. And sometimes when you're making that life shift, you also need to shift the people around you, because you need to find your people. And if your people are unhealthy, you're probably going to be unhealthy. But if your people are healthy, your people are purpose driven, your people elevate you, you're going to be elevated. So I think about that a lot.
Very insightful. And again, the beauty of community, when you can come together and you have like-minded people sharing with each other, it opens so many doors. It becomes an exponential learning opportunity and connecting opportunity, and who are drawn to, I fully agree, those relationships have to change if you actually want to change your inner being, because that very dense frequency, the duality that we're living in, it's a gravity. It is so burdensome. But when we can bring some light and some peace and some space into our body and our relationships, then it is simpler to navigate through those times and to see the different perspectives. And I really think that's really what it is, because I mean, for me, when I look at a body, yes, we can look at the body as a container with parts, but we're also a fluid matrix. And to be able to see the difference in how both are viewed and treated and diagnosed, it's not that one or the other is right or wrong. It's just that they're different perspectives of the same thing. And how we choose to view things gives us a different approach to treating things. And that's again why I'm so excited, because this program that we've put together, it's a 21-day program, daily guided, to give people the tools from my perspective on how to address those adhesions, those postural implications, those areas of toxicity because of stagnation, and how to open them up, how to free the body of those, how to bring that proper breath and support back into our physical container so that we can be spacious and clean and free and view each and every cell as important, not just what cells are important for survival, but what cells are important to thrive. And that's each and every one of them. And how can we bring them into the equation of how we live our life and how we treat our bodies every single day, and how to truly tap into this most beautiful mechanism of the conscious breath to be able to feed and clean each and every cell lifelong, every single day, every single moment. So that's what I'm super excited to bring to the table. And and I know you're going to be coming on to one of our live calls to share more. I would love to hear a little bit about what you would like to share and what you'll be providing.
Well, I had a fascinating conversation with Lauren Roxburgh last week, Low Rocks. And she very much speaks your language, because she talks about the fascia, and she talks about it in a way that I never considered it before. Now, as a surgeon, I'm very familiar. Like, this is not some esoteric tissue to me, right? This is something that I saw every day in the operating room, that I looked for. It is landmark for me. It was something that was very tangible to me. Most people, I'm assuming, when you talk to them about fascia, it's probably some very esoteric, intangible thing. But for me, when she told me that this is comparable to the mycelium in the forest. This is your neural network. This is the communication. This is the way that the body communicates in its totality. And when you have fascia that is thickened, that is damaged, that is scarred, this is a block in the communication. This is a block in our electrical energy. This is a block in our circuit. And this is actually how trauma affects us long term, right? It literally, this is the physical manifestation of our emotional, I don't want to say illness, but our emotional pain, our emotional block. And I had never seen it that way before. I had never experienced it that way before. And it was really eye-opening and revolutionary to me. You two, I mean, if I introduced you two, we could never get you apart. You would just, the conversations that the two of you would have would be just mind-blowing and endless. But, you know, it's what I have seen over my years. I have such a new and great perspective now. You talked about feeling peace and being in peace. And I want people to know that I know exactly what you mean now by that. And I did not know before, right? But even that's kind of your new baseline, is that you understand how to get back there. But let's not pretend that you're not going to have moments where you're not there, because life is always going to come at you, always. But what you're giving people are the tools to come back to peace and to allow for those pathways to be open, to allow for flow to happen, allow to get rid of those blockades, right?
Yes.
And what I'm bringing to the table, first of all, is permission, right? Like, it's okay to not let this disease embody you. It's okay to move past that. But beyond permission, what I'm telling you is that I see this all the time. And I don't care if you're diagnosed with an early breast cancer, a late breast cancer, a metastatic breast cancer. I see disease reversal all the time. All the time. But where I don't see it is if all you do is cut it or burn it or drug it. There has to be more. Now, I am not throwing the baby out with the bathwater. I realize that we have had scientific development. I realize that there is a time and a place for conventional treatment. I am in no way telling people don't get any conventional medical treatment. Everyone is different. Everyone's needs are different. And if you have an overwhelming amount of cancer in your body, you probably need to use some of those treatments for a period of time, right? Like, your proverbial sink is overflowing. We need to mop up the floor. Surgery, chemotherapy, radiation, these are the mops. This is how we're mopping up the floor. However, the far more important part is turning off that faucet. And in order to turn off the faucet, you have to do the deep work. You have to do the examination of your life. You have to think about the things that cause breast cancer. You have to think about them in the context of what is resonating with you. Where does that land with you? What sounds familiar to you? What do you think your why is? And we all need to think long and hard about our why. Because if we don't think about that, and if we don't acknowledge that, and if we don't intervene there, we're never going to move on. And it's the people that do, that take that brave journey, because it's not easy, right? Like I'm constantly reminded of my friend Susan, who was diagnosed with metastatic disease, and everyone was that means the tumor has spread beyond the original part to somewhere else in the body, and most people consider that not curable. And I saw her 2 years later, because everyone was very sad when she was diagnosed with metastatic disease. And I saw her 2 years later, and she looked phenomenal, like literally phenomenal. And I said, "What did you do?" And she said, "I had a husbandectomy." Right? So, sometimes there's hard work in it. And we have to look inward. We have to look on us. We have to look around us and say, how is this environment affecting my health? Right? And what are those manifestations? And we have to intervene.
What really excites me, though, with what you're sharing is the fact that you're giving people the control within themselves, though, to make those choices and to make the differences in their life. Where the other version of that story, you feel like a victim. You go in, oftentimes your body is abused, treated very, very poorly without an understanding. And so you simply have to surrender to whatever's going to happen to you and pray for the best. Where this approach, it provides you with so much independence to make those choices for yourself with the community and with the support of whomever is necessary. But that is so empowering. And I think
it is empowering.
Yeah.
Yeah. Yeah. It's amazing. And we have so much more power than we think.
Yes.
I mean, when we talk about breast cancer, 80% of breast cancers are preventable. 80%. And it's because we don't know enough.
I have a direct experience with my father. He had a little spot of skin cancer. He ended up dying of metastases in his lungs, which I believe actually happened because they ended up taking out his lymph nodes. And after that, he was unable to lie on his back for 3 months with no drainage and all of these things that happened. But after the initial piece, I went to the doctor with him and I said, "I'm just a fly on the wall." I was working on him, and he started juicing, doing some really good things with nutrition. So the doctor's saying, "Well, you know what, your scans are showing no cancer now, but I think you should have radiation." And so my dad said, "You know what, I think I'm going to pass on that. I'm getting some treatments for my daughter," and I started juicing. He's like, "Oh well, be careful. If you have too many carrots, that's toxic for your liver." That's what he said. And I'm just like, of all the things. Yeah, it was kind of mind-boggling.
Right? We need to worry about carrots.
Yeah.
But radiation is good for us.
Right.
Right. It's just it's mind-boggling.
Yeah.
And not everyone is brave enough to stand up and say, "You know what? That doesn't make sense to me. And I'm going to do what I think is right." We've been trained to not trust our intuition.
Yeah.
And I think that's one of the most important lessons that we all need to learn, is that no one is ever going to know us better than we know ourselves. And we need to all dial into that intuition and start to trust ourselves. Because when you're there, you know what's right for you. I tell people all the time, I never want anyone to make a quick decision. I think it's the worst idea in the world, especially when you're talking about your health. No one should be making a quick decision. You should be sleeping on it. You should be meditating on it. You should be really thinking about what that means to me before you decide on anything. And a lot of the time with breast cancer, that's what's happening. People are getting a diagnosis and almost being forced to make a quick decision. Oh, you have to decide right now. If you don't have surgery next week, you're going to have a worse outcome. I mean, it's really, it's almost criminal, the way that people are pressured into making a quick decision. And in fact, that is one of the first things that I talk about in my book. I'm going to give a shameless plug to my book,
Please do.
The Smart Woman's Guide to Breast Cancer, because the first thing that I talk about is take a breath, take a beat. You have time. You have time to educate yourself. You have time to learn. You have time to make the right decision, to build your team, to surround yourself with people that are listening to you, that are hearing you, that you trust and feel comfortable with and want to take this journey with.
And I can see if people are given the perspective that the tumor's the problem, as opposed to the symptom of the problem. Just get it out of me. Take it away. Get rid of it. I want it gone, right? Like you have this very different mindset by seeing it that way than by understanding that there's much more going on. And that is, I think, where, again, I'm so excited about this education to bring forward, because, again, it's the perspective. And then with that comes the pause and the space and the breath and all of the different information that people can gather to make their best decisions.
Yeah, absolutely. And what we have to remember is so many people are taught to think that their breast cancer is some foreign invader. Your breast cancer is a part of you. It's the part of you that's saying, this isn't working. Whatever this is, right? This is your message.
Yes.
And if you can see it as your message, you can respond appropriately, because cancer is a normal response to an abnormal environment. And if you can back up and gain that perspective and figure out why that environmental shift happened, you can shift it back. And you can tell your body and your cells that you're safe. But this is how it transitions back to you, because that communication network, it needs to be open. You need to be in flow. You need to be able to communicate. And you need to know that what you're telling yourself is true, and then let that go to every cell in your body.
Amazing. Well, I cannot wait. We start May 13th is our first live call, and it's a 6-week journey together as a community. So, Dr. Jenn, I can't even tell you how grateful I am that, first of all, you opened this door for this possibility, and the sharing that we're going to do. I have no doubt many lives will be transformed and healed in the most beautiful, intuitive way. Is there any last words you'd like to share?
Well, I'm really excited about this too, because this has been a part of what I do that I've always felt was missing. And we need this holistic kind of communication and interaction. And so much of all of this is mindset, right? And what you believe, this is the placebo effect, right? What you believe will work will, and what you don't believe will work won't.
Yes.
But that belief needs to be all encompassing. And in order for that to happen, our communication network needs to be open. So I am so excited to give my community your brilliant, brilliant tools to allow for this communication network to be open and to wash over them in totality. And any path to healing that helps to accelerate things and make them more meaningful, I'm always excited about, and I am especially excited about this.
Wow. And Greatest Love of All, by the way, was my favorite song when I was 16 years old as well.
It was, it's probably one of the greatest songs of all time.
I fully agree.
And, in 1986, you literally couldn't find a person on earth that didn't know that song or love that song. And it really embodied Linda. She was an amazing person. And sorry, I still get choked up. I just pray that I'm making her proud.
Well, you are. I have no doubt. Thank you so much for your time and for your gracious gifts and your authenticity and your willing to share your story and for your time with all of us together. And there's more to come. So I can't wait. Thank you.
Thank you so much.